Number 9. The date is Wednesday, March the 9th, 2022. Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg.
Present in the room.
Senator Carroll.
Here.
Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith.
Here.
Senator Nemes. Senator Wise. Chairman Alvarado.
Present. All right, we have a quorum. We're established to do business. The first thing we're going to take up is the consideration of the referred administrative regulations. Had a chance to review these. Wasn't sure if anyone has any questions regarding all the proposed regulations that are there. If there are no questions, we'll have shown that we've done our due diligence in reviewing those regulations here in committee. All right, very good. We've got several bills we'll get started on. The first one we're going to start on is going to be Senate Bill 203, which is an act relating to health care. The sponsor is Senator Julie Adams, but I think Senator Jimmy Higdon is here to present on this bill. There is a sub before us. All members should have received that prior to the meeting. And at this time, we'll entertain a motion on the sub. We have a motion. Is there a second? All those in favor, please signify by saying aye. Any opposed? All right, the sub is before us. Senator Higdon, the floor is yours.
Thank you, Mr. Chairman. It's good to be in front of the Health and Welfare Committee, committee I used to serve on, and good to be here. I'd like this morning to use this is Senator Adams' bill, but has graciously let me do a committee sub to it. So I'd like to use her influence to pass the bill and use my content, please. But anyway, this is somewhat an issue that in rural Kentucky we have from time to time. We have a lot of folks involved in the court system that, especially drug court, they're ordered to do drug tests, random drug tests, and scheduled drug tests, and a lot of times they have to travel great distances. I say great distance, 25, 30 miles, and when you have to do that quite often, it's very inconvenient. So every county in Kentucky has a health department. The health department is perfectly capable of doing these drug tests. So what this bill simply does is says that if needed, they shall provide a drug test sample collection service for any individual ordered by the court to complete a drug test. I do not have a fiscal note or local impact statement yet because this is a committee sub. It wasn't available, so that should be coming shortly, hopefully before we pass it out off the Senate floor, so we know what this would cost. But that's the bill, and there is a good reason for the bill.
Thank you, Senator. We have one question, Senator Berg.
Thank you, sir. And I don't know that you'll know the answer to this question, but currently, when you have court-ordered drug testing, usually it's urine testing, and it has to be monitored. It has to be observed. Will the county health departments have the ability to do that, to actually administer these tests? And then the second question, or it's part of the same question, normally now under court order, the person who's court ordered pays for these $50, sometimes more a pop. And, when you're getting randomly tested several times a month, that could be very expensive for people. Would this cost still be transferred to the person who's being court ordered, or is there a way to mitigate these costs, or who's paying for this?
And those are all very good questions, and you're correct. I don't have the answer for those. I'm sure as this bill makes it out of committee, we'll start hearing some of those concerns, and would have an opportunity to do floor amendments or any corrections we need to do to this bill. Because again, I apologize, but I cannot answer those questions. I could defer to the bill sponsor, Senator Adams. But that would not be necessary, Senator Adams. I'm just being facetious here.
Oh, okay.
That's okay. I get that. I get that a lot. Thank you, Senator Byrd.
Very good. Any other questions from members of the committee? Senator Carroll. I know that we're getting kind of late in session, so I know these are real issues that people, particularly in rural communities, that often don't have a private provider to be able to do this. It's going to give them at least an opportunity or a requirement to be able to go somewhere to get this test done. And so I know there's more information coming on this bill. We are getting kind of late in session, so if we're going to have to give this bill an opportunity to move through, I thought it was important for us to hear it and begin the process in getting it through. Any other comments or questions? Not, we'll entertain a motion. You have a motion. Is there a second? Second. Any other questions or discussion? Madam Clerk, please call the roll.
Senator Rocky Adams. Aye. Senator Byrd.
Aye.
Senator Carroll.
I'd like to vote aye and explain my vote.
Please proceed.
Mr. Chairman and Senator Higdon, I appreciate what you're doing. Should this cost end up falling on the taxpayers' shoulders, I will not be able to support this bill. But to move it through the committee now, I will vote aye. Thank you.
Senator Givens. Senator Harper Angel. Senator Howe.
Explain my vote.
Please proceed.
I'll vote aye, and thank you for doing this. I work with this quite often in my practice. It's something that we really need, but I do think we need to explore this a little further. And I've talked to the bill sponsor, and I'll talk to you too about some thoughts I have on how to work through some of that. Thank you.
Senator Kerr. Senator Meredith.
I'd like to explain my vote.
Please proceed.
I'm aye, but I share the same concerns that Senator Carroll does. I'd just like to see the fiscal impact. I'm sure it's probably going to be all right, but again, I don't want to commit our county health department to something that could really be financially disadvantaging to him. So I'll reserve the right when we get to the Senate floor to vote no, but today I vote aye.
Senator Nemes. Senator Wise.
Explain my vote.
Please proceed.
Vote aye, but also Senator Higdon, I've just like my other colleagues, have some concerns, but look forward to working with you on the process with the bill sponsor. Thank you.
Chairman Alvarado.
I also vote aye, which passes 10-0. We're going to defer on consent right now, I think, because we need to wait for that fiscal note, and then also if there's anything that needs to be amended potentially, that would at least make sure that if there is any cost, that the cost would be placed on the individual having to take the test would probably be welcome moving forward as well. Thank you very much, Senator Higdon. We appreciate it. Congratulations.
Thank you, Mr. Chairman, members of the committee. And I look forward to working with anyone on this, and I will get that fiscal note and local impact statement to you so we can see where we're going.
Very good. Thank you. There's also a title amendment on this bill. We'll entertain a motion on that. There's a motion, a second. All those in favor, please signify by saying aye. Aye. Anybody opposed? All right. Very good. Thank you, Senator. Appreciate it. Next on the agenda, we have Senate Bill 95, an act relating to postpartum depression care. The sponsor is also Senator Julie Rocky Adams. Senator Adams, if you'd like to come to the table and introduce yourself or any guests that you might have, and the floor is yours.
Thank you, Mr. Chairman, and I appreciate you hearing the bill. Again, I'm Julie Rocky Adams, State Senator from District 36, and I'll let my guest introduce herself.
Hi, my name's Christina Libby. I'm a resident here in Frankfort.
So as you mentioned in the last bill that we did, this is a Senate bill, and it's been out there for a while. I asked the chairman to hold on to it just to go a little bit later into session so that we could get some feedback on the bill. Well, surprisingly, I didn't get any feedback until it actually landed on the agenda. And so what I'm going to present to you today is prefaced on the fact that I think that, in full disclosure, I think that a sub is appropriate, but in the interest of time, I would like to go ahead and move the bill out and then maybe work on some of these changes that have been suggested on the House side. So I would hope that Christina might share a little bit of her story as to why this bill, I think, is very important.
Thank you very much, Chair. So like I said, my name's Christina Libby. I'm the Health Outreach Navigator with the Homeless and Housing Coalition here in Frankfort. And when I was trying to put my thoughts down on paper on why I feel like this legislation is important, I wrote multiple pages about decreasing stigma, impossible societal standards, and the power of coming forward and sharing stories, and putting faces on statistics. But I went back and narrowed it down to just one page. and tried to pick out the thing that I thought was most pertinent to this legislation. And that is that perinatal mood disorders are sneaky. As someone who has had lifelong struggles with depression, which already confuses most people because in general, I am annoyingly chipper, I all but expected to be hit with postpartum depression extra hard. And with my first pregnancy, I did have some issues early on, specifically with what's referred to as intrusive thoughts, which is where you cannot help but think bad things are going to happen, specifically to the baby. There was one time where it took me about 10 minutes to get all the way up the stairs from my living room because I was terrified that I was going to fall down the stairs while holding the baby. But after I was a mom for several years and I had more conversations with other parents and I became a doula and talked to more people about perinatal mood disorders, I realized that I actually kind of was lucky in my very limited experience. So when I decided to have a second child, I really didn't think much about that aspect. But like I said, perinatal mood disorders are sneaky. We hear so much about postpartum depression that I wasn't expecting suicidal ideations when I was in my second trimester of pregnancy. In the course of a day, I would be talking to a new mother about how the most important thing was for her to take care of her own mental and physical health before she could take care of the baby, which is something that I can tell you no new mother wants to hear and will fight you very hard on. And then I would go home and I would still have the thoughts to myself that I can't tell anyone what I'm thinking. They're going to think I'm a horrible mother. I am a horrible mother. And then, is it better for a baby to have a horrible mother or no mother? Having a negative birth experience is one of the things that can greatly increase your chances of having a perinatal mood disorder, especially when we live in a culture that wraps up experiencing birth trauma with the nice bow of, but the baby is healthy, and then the unspoken, and you didn't die, so why are you complaining? But while that is a story that I heard much too often, it thankfully was not my experience. However, while my second child was born into the hands of a midwife in a calm, quiet apartment, actually a couple blocks away on St. Clair, perinatal mood disorders are sneaky. I had the birth that I'd planned. Why wasn't I happy? I was very fortunate to have health coverage, and I'm also beyond blessed with people in my life who I truly believe saved my life with their attention and support. And I, oddly enough, was also saved by the pandemic a little bit because with schools going virtual, we moved in with my parents so that we could still work. And we live in such an individualistic society that we aren't usually afforded the opportunities to have help. And even if we are, we're taught that we shouldn't accept it or we shouldn't seek it out. And while living with one's parents has inevitable cons, the pros outweighed them greatly, the biggest being the added support. Because perinatal mood disorders are sneaky, and the best way to minimize the damage of something that's sneaky is to bring it into the light and look at it with as many eyes as possible. And this legislation does just that. It puts the information into the hands of both providers and patients. It tells them it's not just postpartum, it's not just depression, and it's not your fault. And it says, here are resources, and they can refer you to where you need to go. And while we still have barriers with the lack of providers to refer people to and access to the few that we do have, that's another thing that we have to bring into the light. And I look forward to continuing working with this legislative body to continually support Kentucky mothers as we grow, birth, and raise the next generation of our Commonwealth. Thank you.
Thank you. And this bill is pretty simple. It talks about requiring the cabinet to make information on postpartum depression and a postpartum assessment tool available on its website. It requires birthing centers and hospitals to provide postpartum information to women, fathers, and family members. And I think that's a piece that's always left out is fathers need to know about maybe what's going on with their wives and have a better understanding. And then it requires healthcare providers providing postnatal care to women and pediatric providers to invite women to complete a postpartum assessment tool. Some of the ideas, and so I think the bill is really solid, but we did receive some feedback, like I said, last minute, and some of those ideas were that, research has shown that the average woman does not seek help for a perinatal mood disorder until about 8 months postpartum. So we want to maybe work on the timeline on that. The other thing, too, is this bill outlines 6 months to have kind of an assessment, but having that 8-month research base, we're going to go ahead and probably expand it to 12 months. And those are the big things that that kind of popped up. And so, anyways, if there's any questions, we're happy to answer.
Thank you, Senator. We have a motion on the bill. There's a second. Before we take the vote, I just want to say thanks for this. I think you've made a proper assessment. This was filed. I was willing to hear it early. You said, no, let's wait and draw some feedback, and didn't hear any until it was put on the agenda. I did hear
The
from
power you have, Mr. Chairman.
I know. But the American College of OBGYN has reached out with some recommended changes. I think pediatricians have had some recommended changes.
Yeah.
I've reached out to those groups. They said, well, we're compiling those recommendations. So they were more than willing to have this bill move forward in hopes of making those amendments, and I think you're committed to doing that. So
Yep.
looking forward to making this bill better. It's part of really our perinatal mortality, which we know in the state of Kentucky we're really poor. This is going to help with that. I think if you've never seen someone, I'll tell you, I'll never forget, I had a patient who so profoundly depressed afterwards, really severe cases of women who are very vulnerable in those moments as well, and at risk to themselves and to their children, obviously, when they go through this. And a lot of times people don't recognize the signs of depression, that they're going through that. And again, I think education is always a good idea. Any other questions, discussion on the bill? If not, Madam Clerk, please call the roll.
Senator Rocky Adams.
Aye.
Senator Berg. Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. Vote is 9-0. Do we want to have this go on consent?
I'd love it, because then we can get working on changes over in the House.
Okay, very good. Is there we have a motion for consent? Second? And second. All those in favor, please signify by saying aye. Aye. Anyone opposed? All right. The matter goes on consent. Congratulations.
Thank you.
Thank you. All right. Next on the agenda, we're going to hear Senate Bill 276, an act relating to Medicaid coverage for sickle cell disease. The sponsor, Senator Neal, welcome. If you'd like
Thank you,
to
Chairman.
introduce yourself and any guests you have, and please proceed.
Thank you, Chairman Alvarado and members of the Senate panel. Senate Bill 276, relating to sickle cell disease, aims to help individuals living with SCD, to help communities, healthcare providers, policymakers, researchers, state and local health agencies better understand who has SCD and their healthcare needs are, and identify potential areas to improve in treatment and services for patients. The bill itself requires the Cabinet for Health and Family Services to conduct an annual review of all medications, services, and treatments available within Medicaid for individuals living with sickle cell disease. The purpose is to determine if the available covered medications, treatments, and services are adequate to meet the needs of enrollees with a diagnosis of SCD, and to see if OHCA should seek to add or recommend additional medication treatments or services. Also, the Cabinet's review would require input from persons of groups in Kentucky with knowledge in the area of sickle cell disease treatment. And finally, it would require Health and Family Services to submit an annual report of its findings and recommendations to the Legislative Research Committee for distribution. This is a bill that's similar to the one that was unanimously passed in Tennessee, and I think they just issued their first report with respect to that. And I appreciate this being heard here today, and if there are any questions, please.
Thank you, Senator. Appreciate that. Do you have any questions from the members of the committee? Senator Meredith.
Thank you, Senator Neal, for this bill. I'm always amazed that we have to take these actions. I think that there's other folks that probably should have ownership for this that would want to address this. One of the concerns I have, and it's not with the substance of the bill, is how you're going to get the data. It's a situation of some Medicaid oversight where I requested some information about addiction recovery, and we have a statute that says the cabinet has to provide us with an annual report on the efficiency and efficacy of those programs, and they said, we can't do it. We don't have the information. Well, I asked the same thing for the MCOs, and they said, well, we really don't have that. So it just concerns what may be missing from this bill is it places no burden on the managed care organizations to participate in this process. And without that, I'm not sure we're going to have all the information that you would want to make this a comprehensive, detailed analysis of what we're trying to do. Certainly this goes to improving the health of our population, and the MCOs, I think, should take the initiative to do these sort of things. But if we have to mandate it, then we probably have to also have to mandate you've got to participate in this. So that's a concern I have with this. Possibly we could go ahead and pass a bill and you and I talk about it, maybe a floor member or something, but I think there needs to be something that has some kind of requirement from the MCOs to participate in this process.
Well, I appreciate your observation, and I certainly would enter into an interaction with you to see where we could go and how we should go with respect to the subject matter that you're raising. Yeah.
Thank you, sir.
Any other questions by members of the committee? Senator, I want to thank you. I mean, sickle cells, for anybody who's never seen somebody who goes through this, it can be tragic disorder, very painful disorder for a lot of folks. Forms clots, obstructions in arteries, and if you don't get blood flow to any part of the body, it hurts pretty bad. People go through crisis with this and a lot of hospitalization. So I think it's important, and it draws attention to a disorder that's been out there for a long time. Any other questions? If not, I'll entertain a motion. You have a motion. Is there a second? Second. Any other questions or discussion? Not, Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. The matter passes with a vote of 9-0 unanimously. Well, like it's on consent?
No.
No. All right.
Thank you very much. I do want to point out that this bill in it has a name for it, Terrence's bill. However, I'll probably amend it on the floor. There was a person that passed in Tennessee that was named after, and one of the individuals that was one of my pages had sickle cell and passed, and I think that it might be appropriate to name this bill after her. Hopefully, we get this passed.
What was her name?
Well, that's why I have
You
to
want to
go
make
get
sure
it,
you
'cause
gotta
I
get
don't
it.
have the whole
Gotcha.
thing.
Very
I
good.
remember
Very
her
good.
and her faces.
Well, we'll make
image. Yeah.
we welcome that amendment and that change to it,
Yes.
Senator. We appreciate you bringing this forward.
All right, and
thank you so
all.
much. Thank
Appreciate you very much.
Next on the agenda, we're going to cover Senate Concurrent Resolution 142. It's a concurrent resolution establishing the Early Childhood Education Task Force. The sponsor is Senator Danny Carroll. Senator Carroll, if you'd like to come forward, introduce yourself and any guests that you have, and begin your testimony.
Thank you, Mr. Chairman and members of the committee. I'm Danny Carroll, the state senator from the 2nd District.
And I'm Debbie Link with the Child Care Council of Kentucky.
Mr. Chairman, members of the committee, during the COVID pandemic, one particular topic has really gained a lot of attention, and it was evident last night for those who attended the chamber dinner. Two words that were said more than any two words during the entire night, and that was childcare. And we have seen, even before the pandemic, there were struggles throughout the Commonwealth, and Senator Givens can speak to this very eloquently. We have areas of the state where there simply are no child care facilities, and that affects every segment of the community. The quality of education, not getting education at an early age, the economic development of a region, and many other areas. And through the pandemic, when we had centers closing, we had businesses unable to staff their positions because of that, and it affected everything that we do in our Commonwealth. And one thing that we are acutely aware of as a result of what's happened is our system simply does not sustain itself. And the goal of this concurrent resolution is to establish the Early Childhood Education Task Force. And this resolution establishes all the facets of the task force, what the goals are, the membership, and all the basic components of the task force. But, Mr. Chairman, the goal is to study every facet of early childhood education. There are many levels of this, dealing with staffing, tuition rates, the models that we have throughout the state, whether that be private, public, centers within business and industry, family care homes, and models that we simply don't even have in our Commonwealth. And we have to look at quality, we have to look at basic care, we have to look at 24-hour care, all the things that we need to meet our parents' demands. We have worked hard over recent years, and we've come a long way in the Commonwealth through the Kentucky All-Stars program to ensure quality throughout the state. But the reality of it is you've got to have a center to have a quality center. And so we have many areas to cover, and it is my belief that through a task force, we can identify all the areas that we need to address. We can look at models throughout the country to see what works in other states. And we can consider each facet that early childhood education touches to make sure that the system that we decide on is a system that will sustain itself over the long haul, that will provide all the needs that we have as a Commonwealth. It is critical that all of our children have access to early childhood education. We know how quickly the brain develops in young children, and those years are critical. And so we must invest the time and, without question, the finances to ensure that these centers throughout the Commonwealth can sustain. And I will ask my guest if she would like to say a couple words.
Just the importance of...
If you'd like to introduce yourself for the record, I'm sorry.
Yes, my name is Debbie Link, and I'm with the Child Care Council of Kentucky. These issues have been long coming, and we finally have an opportunity to really make a difference and to be proactive and kind of flip things on a dime kind of thing. And it's time for us to make a change to our systems and really support early childhood education. So thank you for having me today.
Mr. Chairman, we have worked with numerous stakeholders through this conversation, working with the Division of Child Care, Dr. Vanover, the Chamber, United Way, many providers throughout the state, and everyone is eager to get started on this and to look towards the future and solve these problems.
Thank you, Senator. We appreciate the testimony. We have one question, Senator Berg.
Thank you, Senator, and I really appreciate this resolution. I appreciate the thought behind it. I have one question. When I think of early childhood education versus child care, I think of sort of two different pots. We're talking about starting basically at birth here so that moms can get back to work. And we're not just talking about 2, 3, 4-year-olds, correct?
When I look at it, and from being in the business, to me, it's all early childhood education.
Okay.
Because our kids start learning the day they walk in the door, and that's something that we've gotten away from the term child care within the industry. It is early childhood education, and my center, it's not a child care center. It's not an early childhood it's an early childhood education center is what we refer to it as, and our staff are not babysitters, they're teachers. And that's the trend, and it is becoming a profession. We have made so many strides, but we've got to get the basic model right to be able to succeed in the Commonwealth.
Thank you. Any other questions, members of the committee? If not, we'll entertain a motion. You have a motion. Is there a second? A second? Any other questions or discussion? If not, Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Berg.
Aye.
Senator Carroll.
Aye.
Senator Gibbon.
Mr. Chairman, if I could explain my aye vote.
Please proceed.
Proud to vote aye. Danny Carroll, Senator Carroll, thank you for your leadership on this. It's vitally important that we get this right, and I look forward to the work of the task force over the interim. Thank you.
Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith.
Aye.
Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. The matter passes with a vote of 9-0. Would you like it on consent? No. All right, very good. We appreciate it. Congratulations. The matter will be reported favorably to the Senate floor. All right, next we're going to take up House Joint Resolution 5. It's a joint resolution requiring mental health professional licensure boards to either enter into an interstate compact or to ease or establish reciprocity procedures so as to increase the mental health workforce in Kentucky and declaring an emergency. The sponsor is Representative Ken Fleming. I do believe we have a proposed Senate substitute. Everyone should have had a chance to review prior. So we'll entertain a motion on that sub at this time. There's a motion. Is there a second? We have a second. All those in favor, please signify by saying aye. Aye. Anybody opposed? All right. The sub is before us. Representative, if you'd like to introduce yourself, and the floor is yours.
Thank you, Mr. Chairman. I'm Ken Fleming, State Representative, 48th District, in the northeast part of Jefferson County. And what the chairman laid out, that's basically what it is. It came out of the House in terms of putting some, a requirement, and talking to the chairman and other folks, we changed one word in the title as well as in the resolution to strongly encourage these boards to go through that process, and that's what it is.
Very good. Thank you. So for those who are wondering the change, if you look at the bottom of page 1 on the sub, in section 1, it says that the General Assembly hereby directs the following boards to strongly consider. And I think the original language, it effectively said that it requires the boards to either enter into. So we've changed it to allow a little bit of flexibility there. We appreciate your willingness to be flexible and change the language. Any other questions, comments from members of the committee? We have a motion on the resolution. Is there a second? We have a second. Any other questions or discussion? Madam Clerk, please call the roll.
Senator Rocky Adams. Senator Byrd. Senator Carroll.
Aye.
Senator Givens. Senator Harper Angel. Senator Howe. Senator Kerr. Senator Meredith. Senator Nemes. Senator Wise. Chairman Alvarado.
Aye. The matter passes with a vote of 9-0. Would you like that on consent?
That'd be great. Thank
We'll
you,
entertain
sir.
a motion for consent. You have a motion. Is there a second? We have a motion and a second. All those in favor, please signify by saying aye. Anyone opposed? All right. The matter is on consent. We also have a title amendment on the joint resolution, so we need a motion on that as well. You have a motion and a second. All those in favor, please signify by saying aye. Anyone opposed? All right. Thank you very much, Representative. We appreciate your work on this and your flexibility on it.
Thank you, Mr. Chairman, and thank you for the committee.
Thank you. All right, last on the agenda, we have House Bill 282, which is an act relating to healthcare services agencies. The sponsor is Representative Steve Riley. Representative Riley, would you like to, we have a sub on this before us as well. Would you like action on that now?
Yes, sir, we will.
All right, so we have PSS 2 before the members of the committee. This is a sub that's been worked on, I think, from the original language by several groups, and I'm sure that'll be discussed a bit in the testimony. At this time, I'll entertain a motion on the sub. We have a motion. Is there a second? You have a second. All those in favor, please signify by saying aye. Aye. Anyone opposed? All right, the sub is before us, Representative. Please proceed.
Thank you, Senator Alvarado and committee. I have a guest also with me today. I am Steve Riley, House District 23, and I also have Betsy Johnson with me, and I'll let Betsy introduce herself for the record.
Yes, thank you, Representative Riley. Good afternoon. My name is Betsy Johnson. I'm the president of the Kentucky Association of Healthcare Facilities and the Kentucky Center for Assisted Living. Thank you, Chair Alvarado and members of the committee for letting me be here virtually today. I wish I could be in person, but thank you.
Obviously, the COVID-19 pandemic has negatively impacted long-term care and other healthcare providers. They have created COVID-19 created unprecedented staffing shortages, and they have continued to get worse as time's gone on. House Bill 282 is designed to create where House will require not only oversight of healthcare service agencies, otherwise known as staffing agencies, all the while recognizing the important role that they play in the healthcare delivery system. House Bill 282 requires the following. It requires staff agencies defined as healthcare services agencies to register with the Cabinet for Health and Family Services. It sets basic standards for the direct care staff contracted with or employed by the healthcare service agencies. It requires healthcare service agencies to maintain professional and general insurance coverage, employee dishonesty bond, and workers' comp for all contracted direct care service. It requires the cabinet to maintain a reporting system for complaints against health care service agencies and direct care staff. What it does not do, it does not prohibit staff agencies from operating in Kentucky. It does not set the price that staff agencies can charge for their services, and it does not set the price that staff agencies can pay their contract or employee direct service. Basically, this bill recognizes the need for staff agencies and the importance it has in the healthcare delivery service, but it also puts a transparency model over that so we can be aware of what is going on. That's the basic premise of the bill as it passed the House. Since then, there's been some work on House Committee Substitute. Basically, long-term care and assisted living facilities have worked with staffing agencies to make this bill even better. One, it clarifies the definition of healthcare services agency. Would like to thank Senator Givens for discovering this issue and working on that. It is also a request from the Kentucky Hospital Association to be involved in this. Hospitals are now included in House Bill 282. Previously, the bill was limited to assisted living and long-term care facilities. Some other parts of the committee substitute, it prohibits the healthcare service agency from soliciting or recruiting the current staff of an assisted living, long-term care facility, or hospital. But it also changes the bill that it requires the disclosure of certain financial information only if the Attorney General is investigating a price gouging complaint, and that information will not be subject to open records. That was a request of staff and agencies, and an understandable request that they not be required to reveal that information unless it was necessary. So we appreciate the compromise with American Staffing Association, and with that, I'll be more than glad to answer any questions.
Thank you, Representative. I know that there's a lot of work on Section 4 in particular. There was worry, and just to make sure that we understand the need for this, that there's been a situation during the pandemic when there was a nursing shortage. And I know I've worked at those facilities where we would have a nurse that had been employed for a very long time. There would be a staffing agency who would come in, poach that nurse and say, come and work for me. They'd sign them, and then come back to the very facility that had employed that nurse for a very long time and said, I'll have this nurse work for you, but at a much higher amount, and they were taking a chunk of change out of that for themselves. That was going on around the state, around the country. Several states have taken action after this pandemic in order to stop that behavior. And a lot of people view that as, particularly during a medical emergency, as gouging. Just because we don't like to see people ramp up gas prices just because they can, or any kind of other commodity just because they can. This became a focus of something to fix during the interim. It's part of hopefully to help us better our staffing situations in our long-term care facilities and hospitals. So I appreciate your work on this. I appreciate Kentucky Staffing Association, American Staffing Association coming forward and working on some of the language. From what I understand, everybody was in agreement on this language coming forward. Very good. Do we have any questions from members of the committee? Senator Givens.
Chairman Alvarado, thank you for the opportunity to ask a question. And thank you, Representative Riley, for your work on this bill. I especially want to thank all those that were involved in the work around Section 4. Those changes make it something that certainly moves in a direction that I think I can support. I had real concerns about government entering into the contract space. So I applaud everyone involved in those discussions and trying to find some middle ground around Section 4, because that was very concerning to me. Chairman Alvarado, do we know if anybody from the cabinet is available to speak to any fees that may be incurred as a result of registration and investigation required in this legislation?
I'm not sure if anyone. You do have one person that's signed up to speak against this bill, so we're going to hear from them here in a moment. Is there anyone from the cabinet here or online?
I'm confident, Chairman, that they are likely monitoring the committee meeting. The only ask I would make is that if the language does not provide them some authority to charge fees for the registration and investigation required in the legislation, that they would reach out to you, Chairman, for the purpose of a floor amendment to give them the authority to promulgate regs specific for fees within bounds for purposes of administering this registration process. Thank you.
Certainly, and I know the bill has been on the agenda for a few days, so I have not heard from them to this point. So, Senator Carroll, you have a question.
Thank you, Mr. Chairman. And Representative Riley, thank you for bringing this bill. This particular subject has gained a lot of attention, and I have to admit, I have felt a level of anger over the stories that I have heard, and it's really sad because I have no doubts that there are many legitimate agencies out there who provide a valuable service, but unfortunately, throughout the pandemic, not just in the Commonwealth, but throughout the United States, many of these unscrupulous agencies have opened up and just taken advantage of our healthcare system throughout the country. And my question is for Ms. Johnson. Can you kind of speak to the level, put some numbers to this on maybe what you all have seen as far as the cost and what some of these agencies have been charging healthcare providers?
Yes, thank you, Senator. So, during the last 2 years, my members were calling me about various different issues. And then I started getting calls about, what they were alleging was price gouging. And if you don't mind, I would like to give you a little history of that. So with my executive committee's approval, I actually filed a complaint with the Kentucky Attorney General's office alleging price gouging by the staff agencies. And I received a call from the Attorney General's office. They received my complaint, but unfortunately, staff agencies are not included currently in the price gouging statute. And so the Kentucky Attorney General's office did not have the authority to investigate it. This bill will fix that. So costs were being seen up to 400% increases. And the thing we don't know is how much is being paid to the direct care worker and how much is being pocketed. And again, we value our staff agency partners, but we believe there should be some transparency. And so when I started looking into this, I realized that they're not required to even register in Kentucky. And you alluded to this, but you're right. There's some, fly-by-night companies, the quality of the staff that they might be sending. I'm hearing complaints about the quality of the staff. And so I believe this bill will not only shine some light on the costs that's being charged, but also improve the quality of the direct care workers that are coming into long-term care facilities and now hospitals. So it's a very important bill, and I appreciate the support.
Thank you. Thank you, Mr. Chairman.
Thank you. Any other questions? If not, we have one person who signed up to speak, Janie Morris. If she's here, she'll want to come forward to the table here if you'd like to introduce yourself, and please begin your testimony.
All right.
You want to make sure your microphone is on there.
It is. Thank you, Senator Alvarado and members of this committee. My name is Janie Moores. I own BJM Medical Staffing in Lexington and have owned that business and worked in it every single day for over 50 years. So I want to correct one thing that was just said. I'm not here to speak against this bill because we, and there are many members of our medical staffing and nursing agencies here in this room who are Kentucky businesses that run very honestly and fairly. And we do not do these things. And we resent these travel nurse agencies coming in. So we're with you on this. And you've got to start on possibly addressing this, but we feel like there are many other things that we know from however many years, but at least from my 50 years, the problem started over 20 years ago. And a lot of this goes back to the root cause, which is the high insurance costs that we all pay. It used to be when I started my business, I would pay this one sum that was significant for insurance, and everything was all in one group, and it was all on one insurance page that we would give an insurance certificate to all of the facilities that we work with. Now it takes 2 pages because everything is a la carte and you've got all these expenses. So we've got everything that you call for in this bill and more, way more besides. Because I'm telling you, if our nurse goes in somewhere and they're working and they're doing everything correctly, if something goes wrong, we get the blame for it. So that's why we carry so much insurance. I believe those insurance costs are at the root of this problem. And here's the problem. We have begun to dilute and water down the nurse skills that are in these facilities, whether they're in long-term care, they're in hospitals, or wherever. Because we now no longer have enough acute nursing care facilities because they don't have nurses who can handle trachs and feeding tubes and so on. And this is because insurance companies are saying, we started having so many claims in those areas, we just said, you know what, you take any patients in like that, that's on your own. We're not covering that. So the names began to change on the signs of these facilities from skilled care facility to such and such nursing center. It was very subtle, but we started seeing there were fewer and fewer nurses. Nurses were doing what the doctors were doing because the medical director maybe wasn't even an MD who lived in Kentucky. And when our nurses had a question that was needed to be answered and responded to by an MD, they couldn't get him on the phone in Texas or North Carolina or wherever he was. So you're worried that there aren't doctors in there. Then there are fewer nurses because they're complaining, I'm not going to jeopardize my license by making decisions that need to be made by an MD. So then you've got fewer nurses, and now the nursing assistants or nurse techs are forced to do things that only the nurses had the proper training for. So we've got an education problem. We've got a problem with the facilities not having the right equipment that would protect the nurses and nursing staff from injuries. All sorts of back injuries come from the patient transfer. And hospitals can afford to have the overhead hoists or the bedside hoists. But in a nursing home, the patient is on a sheet and somebody pulls them from the bed and into, could be a recliner, it could be hopefully a cardio chair, something that could at least lay flat. But there's where, again, insurance companies said, whew, we're getting all these back injuries and knee injuries and everything else from the nurses and nurses. So if you have people that need that, we're not covering that. So now we have fewer and fewer skilled people to perform that, and what happens? They go out of state to get nurses to come in and do that. And we just feel like if we can address some of the education so that these nurses can now get back to handling the more acute care patients, they can be protected and not be overworked. That's what we wanted to address, and we felt like that was all missing from this bill. So it's not that we're all against this. We just think there's a better way, but nobody ever asked us.
Thank you, Ms. Morris. I've been practicing medicine in this field for 27 years now. So some of the things you're describing, I know in my facilities don't occur. I mean, we have Hoyer lifts. We do have multiple people that help. And these very issues on staffing have occurred in my facilities. So maybe that happens in other ones. I can't speak for all of them, but I can assure you that in mine, some of those comments aren't necessarily true. Listen, I appreciate the insurance costs. You're speaking my language. Everyone here knows how I feel about tort reform in this state that has been desperately needed. I file that bill every year. The personal injury attorneys in our state seem to think that I'm not telling the truth. That's not real. That they need the data, and I've filed bills to try to collect that data and get that information because stories like yours are rampant all over the state for providers, people that provide that, and I'll continue to fight for it. As far as education, I'd encourage you to look at Senate Bill 10, which was passed this year, that is now going to be going to the House, that addresses that very issue. So the issue about education, because we're very familiar with the workforce situation. We've heard testimony from dozens of people that have come before us and worried about why we don't have enough nurses, why there's a workforce shortage in general. We've begun addressing those issues in another bill that's already moved and it's already going over to the House for consideration. I think it's going to be on the agenda this week. So Senate Bill 10 is a discussion on trying to revamp the Board of Nursing to help accelerate education, to have more nurses available within our state. So those actions are being taken in other pieces of legislation. All right, we do appreciate you coming forward today. I know it's always, if you're running your own business, to take time out of your day to come here, we appreciate you coming. Any questions for Ms. Morris, for members of the committee? All right, we have a motion on the bill. Is there a second? We have a motion and a second. Any other discussion from members of the committee? Not, Madam Clerk, please call the roll.
Senator Rocky Adams, Senator Byrd, Senator Carroll,
Aye.
Senator Givens, Senator Harper Angel, Senator Howell, Senator Kerr, Senator Meredith, Senator Nemus, Senator Wise, Chairman Alvarado.
Aye. The matter passes 9-0. It's eligible for consent. Would you?
That'd be great.
Right. I'll entertain a motion for consent on this bill. We have a motion. Is there a second? We have a second. All those in favor, please signify by saying aye. Anyone opposed? All right. The matter is on consent. Congratulations, Senator. We appreciate you bringing this, Representative. We appreciate you bringing this forward. It's important legislation, I think, that needs to be done. And Ms. Morris, I'll be happy to talk to you as well. If you have any other discussions on this matter, we're addressing a lot of those issues as well.
Thank you for the information on Senate Bill 10 because we weren't aware of that.
Thank you very much. Appreciate that. Any other questions or matters before this committee? If not, we stand adjourned. Thank you.